will learn in detail about the different types of bones present in human body. We will discuss this topic under two headings. First, we will discuss about the types of skeleton and the bones present in it, and then we'll talk about different types of bones classified based on their shape. First, let's try to understand what exactly or how exactly the human skeleton is organized. Remember, the human skeleton is organized into two distinct regions. What are they? First, we have the axial skeleton, and then we have the appendicular skeleton. Now, what exactly is the meaning of axial skeleton? Axial skeleton includes all the bones that are present in the central axis of the body or close to the central axis. So what are the bones that are included as axial bones? Now it begins with the skull, right? So first we have skull, then we have the vertebral column, right? And then we have the thoracic cage, right? So how many bones actually make up the axial skeleton? Remember, in skull we have about 28 bones including 6 ossicles, right? Then the vertebral column is made up of 26 vertebrae including cervical, thoracic, lumbar and sacral. Then in thoracic cage, right? In thoracic cage we have one sternum, right? And then we have 12 pairs of ribs. In addition to this, one more bone that is included as bone of the axial skeleton is a bone present in the neck, and that is the hyoid bone, right? So these are the bones that form the axial skeleton. What about appendicular skeleton then? Remember, appendicular skeleton is further divided into the girdle and then free limb. So we have bones forming the girdle and bones forming the free limb. And then in girdle we have two. What are they? We have the shoulder girdle. So this is the region of shoulder girdle, and then we have the pelvic girdle, right? So we have pelvic girdle, and in free limb we have bones of the upper limb, right? Bones of the upper limb, and then we have bones of the lower limb. This is how we group the bones forming the appendicular skeleton. So when we talk about the shoulder girdle, remember the shoulder girdle is formed by the clavicle and the scapula, right? Then we have bones of the free upper limb, which begins with the humerus. Then we have the radius and the ulna, and then we have the bones forming the hand, including the carpal bones, the metacarpals and the phalanges. So these are included as bones of the free limb. When we talk about the pelvic girdle is mainly formed by the hip bone, whereas bones of the lower limb are formed by the femur. Then we have the tibia and the fibula. And then we have, of course, the skeleton of the foot containing 7 tarsal bones, 5 metatarsal, and then 14 phalanges. This is how we group the bones of human skeleton, right? Fine. So once we have learned this, let's try to understand what exactly are the types of bones. And remember, we are classifying bones based on their shape or appearance. First, we will try to list the different types of bones, and then we will see their examples in detail. The first type of bone that we have based on the shape is long bone, right? Then we have short bones. So we have long bones and short bones. Then we have flat bones. Then we have irregular bones, and then we have pneumatic bones. So we have the pneumatic bones, and then we have the sesamoid bones, and then we have the accessory bones, and finally we have heterotropic bones. Heterotropic bones is not often included as a type of bone based on the shape, but still we will discuss it. So these are the 8 different types of bones that are present in human body. Now let's try to learn a little bit in detail about them. So first we'll talk about the long bones. Now what exactly are long bones? Long bones are those whose length is more than the width. That is the simplest definition of long bone, right? The long bones can be further grouped as typical long bones. So we have typical long bones, right? And then we have miniature or short long bones. So these are the two subdivisions of long bones. Now what exactly is the meaning of a typical long bone, right? When you call a bone as typical long bone, remember it should have two epiphyses. It should have two epiphyses plus one diaphysis, right? Means to say that it should have two ends which form the epiphysis and one single shaft. This is a must to call a bone as a typical long bone, right? This has been asked as an MCQ in previous years, right? What is a typical long bone, or what are the parts of a typical long bone? Remember, it has two epiphyses and one diaphysis, right? Then these typical long bones will have medullary cavity. They have medullary cavity, right? Most of these bones are present vertically. These are vertically oriented in the body. For example, when we talk about the bones of the upper limb, let's take humerus, radius or ulna, or in the lower limb, the femur, tibia or fibula. All of them are vertically oriented, right? This is one more important property. Then all these bones are present mostly in the limbs, right? Almost all of these bones are present in the limbs. These are some of the peculiar features of typical long bones, right? What are the examples for typical long bones? As I said, the typical long bones include the humerus, or we have the radius or the ulna in case of upper limb. In case of lower limb, what we have? We have the femur, then we have the tibia or fibula. All these are called as typical long bones. What about the miniature long bones or short long bones? Now let's see about them. These are characterized by presence of one epiphysis, single epiphysis plus single diaphysis. So that is the typical feature of a miniature or short long bone. Where do we find such bones? Remember, these are found as metacarpals or phalanges in the hand, or metatarsals or phalanges in the foot. So metacarpal bones, metatarsal bones and the phalanges are the best examples for miniature long bones or short long bones, right? So what you must remember is, what are the typical features of typical long bone? That is an MCQ. And what are the examples for miniature long bones? That again is an MCQ. Once we have learnt about the long bones, let's talk about the other types of bones. This is the short bones. Now what exactly are short bones? Short bones, as the name suggests, have a less length. So the length and width is almost equal and they appear cuboidal in shape. Where do we find the short bones? Remember, short bones are typically found as the carpal bones, right? They are found as carpal bones, or they are found as the tarsal bones. So they form either the wrist or the ankle. So these are referred to as short bones, right? What about the other types of bones? Then apart from short bones, what we have is the third type, let's say we have is the irregular bones. So let's imagine we have irregular bones. What are irregular bones? Irregular bones are those which do not have a definite shape. What are the examples? The best example you can think of is the vertebrae, right? The vertebrae are the best example for irregular bones, and also we have the hip bone. Any other bone that is irregular in shape? Remember, bones forming the base of skull. Bones forming the base of skull, these are examples for irregular bones. Even these are very important as MCQ questions. They will give you the name of the bone and they will ask you which type it belongs to, right? So know what type of bone it is and what are the examples for it, right? Then let's see about the fourth type. The fourth important type is the flat bones. Now what exactly are flat bones? They are flattened like a plate, right? Now best example for this are bones of vault of the skull. Bones of vault of skull, right? Remember, bones forming the base of the skull are examples for what type? they are irregular bones. Whereas bones forming the cranial vault, they are the best examples for flat bones. What are the other bones? Remember the bones of the thoracic cage. What bones? Remember the sternum. Then we have the ribs and also we have the scapula. All these are examples for flat bones. Right? Fine. What about the next type? The next type we have as pneumatic bone. Now what exactly are pneumatic bones? What is the literal meaning of the term pneuma? Pneuma means air, right? So these are the bones which have air inside. So where do we find such bones? Remember, examples for such bones include the frontal bone, then we have the ethmoid, right? Then we have sphenoid, right? And then we have the maxilla, right? And we also have the mastoid part of temporal bone. Mastoid part of temporal bone. All these bones actually contribute to formation of facial skeleton, right? Now these bones which have the pneuma or air-filled cavities inside also give rise to paranasal air sinuses or mastoid air sinuses. So wherever we have sinuses, those bones are examples for pneumatic bones. The function of pneumatic bones, they make the bone lighter, they also add to the resonance. Right, this is regarding pneumatic bone. What about the next important type? Apart from pneumatic bone, the next important type we have is a bone called as sesamoid bone. Now what exactly are sesamoid bones? Remember, the literal meaning of sesamoid comes from the word sesame, which means seed. So sesamoid bones are small seed-like bones which develop within tendons of the muscles. These have few peculiar features or characteristic features. Now what are the features of these sesamoid bones? Remember, sesamoid bones do not have periosteum. They do not have periosteum. What is periosteum? Periosteum is the outermost covering of any bone. So sesamoid bones lack periosteum. Then sesamoid bones lack Haversian system. They lack Haversian system. These develop within the tendon of the muscle. Develop within tendons, right? They develop within tendons of muscles, right? And then they develop from multiple ossification center. Develop from multiple ossification centers, right? These are some of the peculiar features of the sesamoid bones. What are the examples for sesamoid bones? Remember, the best example for sesamoid bone is the pisiform bone. Where exactly pisiform bone is present? Remember, this is present in the tendon of flexor carpi ulnaris muscle. In entrance exam, these are often asked. The peculiar features are given as statements and they will ask you which of the following statement is true or false regarding sesamoid bones, right? Then for each sesamoid bone example you must know in which bone or in which muscle it is present, right? For example, the pisiform is present in flexor carpi ulnaris tendon. Then the next important type of sesamoid bone is patella. Now as we know, patella is present in front of the knee joint and this is present in quadriceps femoris tendon, right? This is what I said. For each of the sesamoid bone, you must know in which muscle it is present, right? So apart from patella, we have the next important sesamoid bone which is referred to as fibula. Fibula is present in the lateral head of gastrocnemius muscle. Lateral head of gastrocnemius muscle, which is one of the muscle of back of the leg. Then we have sesamoid bones which are present in peroneus longus tendon, right? Apart from peroneus longus, are there any other sites or muscles where we have the sesamoid bones? Yes, it is also found within the adductor pollicis muscle. Adductor pollicis muscle, one of the muscle of the thenar eminence, right? Then we have it in flexor pollicis brevis and flexor hallucis brevis. These are the different locations where we have sesamoid bones. What you must know in sesamoid bones, where exactly these bones are present and in which muscle they are present. What about the function of sesamoid bones? Remember, sesamoid bones act as pulleys for muscle contraction. One, they alter the direction of pull of the muscle, and they also reduce the friction between the tendon and the underlying bone. These are the three important functions of sesamoid bones, right? In the topic of bone, this is one more favorite subtopic for examiners for making MCQs. So remember, in sesamoid bones, you must know what are their peculiar features and then the examples for them and in which muscle each sesamoid bone is present. Fine. Once we have learnt about the sesamoid bones, let's see about the other types. The next type of bone we have is the accessory bone. Accessory bones, right? So this is the seventh type. What are accessory bones? Remember, accessory bones are not always present and they are present occasionally. Their presence will not alter significantly the function of any part of the body. Now, what exactly are accessory bones? Remember, accessory bones are not always present, right? And their presence will not significantly alter function of any part of the body. Examples for such accessory bones include the Vermean bones, right? The Vermean bones also referred to as the sutural bones. Remember, these bones are present in the lambdoid suture. They are present inside or within the lambdoid suture. Then we have an additional bone called as os trigonum. Now this is an accessory bone which is present close to the talus. Then we have os vesalianum, right? And os vesalianum is present close to the fifth metatarsal bone, and then in the upper limb we have a bone called as patella cubitis. Now this is similar to the patella of the knee joint. So cubitis refers to the cubital fossa, right? So this is an accessory bone which is present close to the olecranon process of the ulna, right? So these are examples for accessory bones. Accessory bones are present when ossification centers remain separate. They fail to fuse with the main bone. Those are called as accessory bones. The last type of bone or an additional type is referred to as the heterotropic bones. Now, what exactly are heterotropic bones? Remember, these are not true bones, right? These are not true bones. They are formed by either ossification or calcification of a hematoma, calcification of a clot. Imagine you have a bleeding within the muscle. That hematoma forms or undergoes calcification or ossification to form a bone. Such bones are referred to as heterotropic bone. The best example for this is referred to as the rider's bone. The rider's bone are present usually within the adductor muscles of the thigh and typically found in horse riders. The horse riders are prone for multiple bleeds in their adductor muscles of the thigh, and within the adductor muscles, these clots or hematoma can undergo calcification or ossification, giving rise to formation of heterotropic bones. So these are the 8 types of bones you must know, right? Know about why they are called so, what are the examples and where they are located, right? So once we have learnt about these bones in detail, let's try to quickly summarize. We started the discussion with knowing the types of skeleton. We know that human skeleton is organized into 2 distinct types, axial and appendicular. Axial skeleton include the bones which are present in midline or close to midline. Appendicular skeleton includes the girdle bones and then bones of the free upper limb or free lower limb. Right? So free upper limb or free lower limb. Then when we talk about different types of bones, the bones are classified based mainly on the shape, and we learned that there are about 8 distinct types including the heterotropic bone. Long bones are usually found in the limbs and they are further grouped as typical long bones and miniature long bones. Then we have short bones, best example are carpal or tarsal bones. Then we have the flat bones, the best example for which include bones forming the vault of the skull. Then we have irregular bones. Best example for irregular bones are the vertebrae and the hip bone. Then we have the pneumatic bones. The best examples include frontal, ethmoidal, sphenoidal, maxillary, and the mastoid process of the temporal bone. Apart from pneumatic bones, we have sesamoid bones which develop within the tendons of the muscles, and the best examples are the pisiform, patella, and then the fibula which is present in the lateral head of gastrocnemius. We also listed 4 more locations where we find sesamoid bones. Then we have axillary bones which are not always present, and they are present because of incomplete ossification. Then heterotrophic bones are not true bones, they are ossified or calcified clots. This is regarding